this video, we review infection control requirements under Ontario Regulation 136, personal service settings, for any premises that offer body and ear piercing services. In any personal service setting, there is a risk of spreading infections such as hepatitis B, hepatitis C, and HIV if services are not provided correctly. Public Health Services works with owners and operators to ensure that services are done in a safe and sanitary manner. The goal is to prevent infections. When performing ear or body piercing, instruments can become contaminated with blood or body fluids that can carry disease-causing organisms. It is important that proper infection control precautions are taken to protect clients. Ear and body piercing are invasive procedures. If using a piercing gun, it must only be used to pierce the lobe of the ear. Follow your manufacturer's instructions for safe use. Body piercing involves a hollow needle being passed through tissue, followed by insertion of jewelry into the hole. To protect yourself and your client during piercing, it is important for you to do frequent hand hygiene and wear gloves during the procedure. Gloves must be discarded after the piercing. Hand hygiene can be performed with alcohol-based hand sanitizer when your hands are not visibly dirty, or with soap and water if your hands are visibly dirty. Work surfaces must be cleaned and low-level disinfected between clients. Any lubricants or creams must be applied using a single-use applicator to prevent cross-contamination. Critical items are those which penetrate the skin, such as needles and jewelry. Needles are to be purchased sterile, single-use, and disposable. Jewelry and reusable equipment can be sterilized on-site if Public Health has approved the use of a sterilizer at your premises. Sterile jewelry and equipment should be opened in view of client, only when ready to begin the procedure. Ensure packages are opened in a manner that avoids any contamination of needles or equipment, and be sure to check expiry dates prior to use. Sharps must be disposed of immediately after use into an approved sharps container. Replace sharps containers when they reach the fill line. Sharps containers must be disposed of in an approved manner. Before piercing, check that your client's skin is free from any open cuts, wounds, rashes, or signs of infection. Do not provide service if you have concerns about any skin conditions, and advise your client to seek medical attention. Prior to the procedure, apply skin antiseptic. If marking the skin with a single-use marker or toothpick, mark the skin, and when the mark dries, apply skin antiseptic. Jewelry used for body piercing must be kept sterile until point of use. Items such as needles or biopsy punches that penetrate the skin must be purchased prepackaged sterile and intended for single use. Before using sterile items, check the expiry dates and do not use expired equipment. Sterilizers must be operated, monitored, serviced, and repaired as per the manufacturer's instructions for use. After each use, immediately clean instruments thoroughly with detergent and water or with an ultrasonic cleaner. Leave clean instruments to air dry. If it is not possible to clean immediately, dirty instruments should be placed in a labeled container in the dirty area of your reprocessing room to soak until cleaning can be done. Package equipment individually in sterilizer pouches equipped with temperature-sensitive indicators. Sterilize equipment and ensure packaged equipment is completely dry prior to storage. Each sterilizing load must be recorded in the logbook and must include date, items sterilized, temperature pressure, cycle length, and operator's name. Spore testing is to be completed bi-weekly, and the date of spore testing is to be recorded in the logbook. Spore test results are to be kept on-site and available at all times for review by a public health inspector. New sterilizers, or sterilizers that have been serviced or relocated, must not be used until 3 negative spore test results are obtained. Failed spore tests must be reported immediately to Public Health Services. Before providing a personal service, the client name and contact information must be collected and retained by staff. Sterilization and disinfection records, accidental exposures to blood and body fluid, and records related to invasive procedures must be kept on site for 1 year and retained for 2 years beyond that. For more information, please contact Public Health Services.